And welcome back. We're so happy this morning to have Dr. Gray Erlacher with us, Erlacher Medical Services in Rocky Mount. I believe it's 130 Roundabout Court.
That's correct.
Absolutely. So you've been on before, but a lot of people didn't see or haven't seen and heard. So I wanted to get his Dr. Erlacher's word out because you have so many great services, and the way you do business is so wonderful now because, you know, I love the. Well, let's talk about first. It's similar to concierge medicine. Is that correct?
Well, there's a similarity.
But it's a membership thing.
Yeah.
It's a membership.
Yeah, and
Talk
there's a lot of
that.
different terms out there.
Yeah.
I kind of have gone with the term direct primary care.
Yes.
And part of that's because the insurance system has become so frustrating.
Oh, it is.
On both sides. As a patient, it's hard to get an appointment. You feel like you are rushed in your appointment. You don't get all of your questions answered. And on the provider side as well, we felt just overwhelmed by the paperwork and just by the system.
Yeah.
And a lot of doctors are burned out, about a 70% burnout rate now across all specialties. And so I just didn't feel right about that.
Right,
it's not the way I went into medicine to practice.
Exactly.
And so we've taken the insurance company out of the exam room, basically.
That's good.
They're not telling us how to practice.
Well, that's really good.
But we've managed to actually keep it affordable. And that's the big reason why people use insurance. It's because it helps make healthcare affordable. And I think the purpose of insurance should be when you have a crisis, something catastrophic happens, and you're in the hospital and you need emergency surgery or something like that. But for the day-to-day care, insurance is not very effective.
Right.
It would be like using car insurance when you need to get gas and when you need new wiper blades.
Absolutely.
Instead of needing a new transmission, for example. So we've kept it affordable with a monthly membership and a small copay, $20 copay for office visits. And concierge implies a little bit extra service.
Yes.
You know, maybe like an executive type service. And it can be fairly expensive, and usually there's a pretty big annual fee.
Right.
We've tried to make it a little more affordable for everybody.
So you have a monthly fee, is that right?
That's correct. $50.
You have $50. I mean, wow. Most people spend more than that, you know.
Just cable television.
Medical, yeah, absolutely.
Yeah, so it actually, and if you have a high deductible, it actually comes out ahead because a lot of people on their current policies, and next year it may even be worse, $5,000, $8,000 deductible that you spend before insurance even kicks in.
Yeah.
So, and with our patients, they can still use their insurance for prescriptions, x-rays, lab tests, specialist, hospital. So, so it's just for primary care, family medicine.
Well, you have what I like, another thing that I like about what you do is shorter wait times. You can get in today or tomorrow, not 2 weeks from now, not 3 weeks from now. I just got a phone call that my dentist has canceled me. I'm like, okay. So, you know, chances are at your office, you're not going to get canceled.
Oh, no.
Today or tomorrow, you can go.
Oh, yeah. Yeah, and when you're sick, that's when you want to get in.
That's when you need to go.
You don't need an appointment 3 weeks from now.
Exactly.
So, yeah, we have a lot of accessibility, and I know my patients.
Yes.
In some practices where I've worked, you have maybe 2,000 or 3,000 patients, and you really can't keep up with that. So we have a much more personal approach to things. I know my patients. They can get a hold of me. In fact, we do a lot by texting. That's really popular with some people.
Okay.
And if
that's
it's
pretty good.
10 at night and you stubbed your toe.
Text a doc.
Yeah, so, and it's great for me too because I can solve a lot of problems, save people time. It's been great.
Well, that is so good. And as things go on, as you said, with insurance companies and things like that, we're so frustrated. We get so frustrated. And you know, $50 a month membership is what you pay to go to Erlacher Medical, and that's it. I mean, you know, it's a membership. If you don't go that month, that's fine. But then you might need to go several times the next month. So.
Well, that's true. Yeah, and hopefully we're keeping people healthy enough they don't have to be
Absolutely.
in. But you know, life is unpredictable, and people go through spells where they have medical problems, and
Sure.
that's what we're there for.
And now you treat chronic diseases, all of this.
Yes, of course, here in the South, we've got a lot of diabetes,
high blood pressure, yeah.
And the risk for heart attacks and strokes. So we want to keep people out of the hospital,
Yeah,
healthy,
sure.
living life. I try to reduce unnecessary medications. Our current healthcare system, it kind of rushes people through appointments, and then you get a new prescription, and pretty soon you're on 20 medicines, and who knows what they're doing.
Yeah.
Interactions and side effects, and so it takes time to do that.
Yeah, absolutely.
When I was working in the insurance system, we would have maybe 10 minutes, and then a lot of the time was just documenting. And now I'm able to spend 30 minutes or more with patients,
And that's
especially new
unheard
patients.
of, because it's not a numbers game at your office. I mean, you don't have to be out of my exam room in, like you said, 10 minutes. If I need the time, then I can get it. And sometimes you feel like you need some extra time. I mean, you want to feel like you're important. I mean, you're an important patient, not a number. I've got to get out of your room because I've got to see 30 patients, you know, before lunchtime. So,
Well, you know, years ago they started going to putting stopwatches on your chart. I can't do medicine that way.
No.
Sometimes it just takes a little time to figure things out, and you've got to give the person time to tell their story and
well,
not feel
history is
rushed.
important. It's important for you to know the history of that person.
That's where mistakes happen, and that's what really concerns me about today's healthcare system, is that it's very, if your haste makes waste, I guess is the old saying, we're likely to miss things, and with all this pressure to rush,
Right.
I'm really concerned we're missing things, or we're being hasty. And sometimes I don't really get to the answer for 20 minutes.
Right.
But if you've only got 10 minutes, you're never going to get there.
Exactly.
And so that time is important. Even with all of our technology that makes things faster, it still takes time for a human being to tell their story of what they're experiencing, and for the provider, the doctor, to listen and understand what's going on.
We're going to have, and your office has a dual role. I love this. Kimberly Erlacher, Dr. Erlacher's wife, works with him, along with him. So tell us a little bit about what she does.
Well, she keeps me straight.
Well, that's good.
Which is almost a full-time job. But, well, she already had her practice. She's an esthetician, a licensed esthetician in North Carolina, and very passionate about her work. And I think she's excellent, of course. But I know I'm biased, but she really is an excellent esthetician. She's passionate about skincare.
Yes.
And so she already had her skincare practice when I decided to go into practice, and so we merged and shared a space. And so it's very complementary. I do some cosmetic type treatments such as Botox and things like that, which integrates well with what she's doing.
Sure.
So we treat not just cosmetically, but some skincare type problems, rosacea, acne. We do quite a bit of that.
I'm going to have her own. I'm going to have Kimberly
she'd be a great
come.
host. Yeah.
Yeah, absolutely. We'll have her come and kind of go over what she does, because, as you said, she does an array of things, and I was very impressed when I talked with her when I was in your office. So anyway, if you're having skin issues, please check that out as well. That's something that y'all offer as well with Kimberly. So anyway, we hope you will, 1:30 Roundabout Court, and you can call, let's see, 316-5772.
That's correct.
For an appointment.
5772.
Yes.
And we have a website, erlachermedical.com.
Okay, erlachermedical.com. and you can go to their website and learn more about what they do, other than some of the things we've talked about this morning. So $50 a month is what you pay. You don't have to worry about insurance. I love the shorter wait times. Can get in today or tomorrow. All of these advantages with Erlacher Medical. So we appreciate you coming this morning.
Thank you very much.
Really thank you, and what you do in our community. So we'll have you back another time, have Kimberly back, and hopefully have you on our health show again, and all of that. So anyway, thank you, Dr. Erlacher, for coming this morning.
Thank you very much.
And we'll be right back right after this.